Welcome, friends. This is Pastor Brian Hudson, New Covenant Church. Looking forward to sharing with you a COVID update, talking about what is continuing as a pandemic. We're navigating through this. We've got vaccines, but still the most important thing is practice, what we actually do. Our practices are so important. So we have Joycell Ingram, who is a registered nurse. She is a school nurse, which means she's on the front lines, literally on the front lines every day, and trying to help the children and educate parents, keep the schools safe. So Joycell, Nurse Ingram, welcome.
Thank you.
All right.
I'm glad to be here.
All right. Appreciate you taking this time because we continue to have concern for our community, for our churches, for our families. And as leaders and practitioners of different types, with me in ministry and you in medical science and nursing, as practitioners, it's our job to help people as much as we can, to educate and to inform. I want to ask you, first of all, you have a presentation. We're going to look at that in a moment, and about going to school safely and getting back in school and staying in school. Let's talk about, first of all, the Omicron variant. A couple questions, first of all. So we're clear, do the vaccines we've already received, the boosters, are they effective with this Omicron COVID variant?
The vaccines that we have, Moderna, Pfizer, and Johnson, appear to be effective with the Omicron, as well as the Delta that was before Omicron. Seems to be effective at lessening the severity of the disease or the illness once someone contracts it.
Okay, but it does not prevent contracting. Is that correct? It doesn't prevent it.
No.
Not entirely.
Especially the Omicron. We're learning, or scientists are learning that particular virus or variation of the coronavirus, the Omicron, has increased amount of infection rate. It's easier spread than the Delta and the original COVID-19. So with that means that more people are going to get the virus, but they will have less severity in their illness. Okay. So from that point of view, the vaccines are working and they are helping. I would encourage anyone to get them.
So let me ask you now, so people who have vaccination and boosters, as I have and you have, we still need to do safe practices, correct?
Exactly. Yes, you do. Because you don't want to get infected at all. So in order to avoid the virus being passed on to yourself, you want to continue the practices that were started, and even they're suggesting that you now use a different face mask. Not only your medical face mask, but the N95 is being added to the tools that we can protect ourselves with. So it is very important to continue to wear your tools of protection with being vaccinated and boosted.
What about spreading? People who are vaccinated and who have booster, can we spread COVID to others?
Yes, I believe that is true. If you can catch the virus or the illness from someone else, then that means that it was spread to you. So then that means that you have germs or particles of the virus either in your nose or from your mouth when you speak that can be transferred or carried to someone else.
One of my concerns in the whole pandemic, Joycell, has been that people not be selfish in this and think, well, I'm fine, I'm good, because we are around other people.
Right.
And we have
Exactly.
older people in our circles, in our families.
Yes.
And so we want to work and to protect ourselves, but I would even say more importantly, to protect others around us. How important is that watching out and helping others be safe as well?
It's very important. Dealing with kids and some adults, especially in the school setting, it appears that some don't understand that if you protect yourself and you use the proper gear, the proper tools to protect yourself, then inadvertently, not even focusing on it, you're protecting others, because you're keeping your germs from spreading to others. And we don't know, this virus is such a mysterious virus that we don't know who has it and who doesn't. You can be asymptomatic, which means you don't have any symptoms that are displayed that people can actually see, but you have the virus. And so that's how it's so easily transmitted, is because you can have the virus and not know you have it. And so that's another reason for wearing your protective gear and upping that to an N95 mask.
Yes. Well, this I know, I have N95 mask, so I'll say this: when I'm wearing mine, I can't have a conversation with you. I'm not talking to people. I can barely breathe, in that thing. But of course, that's why it's so good, right? Because it filters out everything. That's
now
harmful.
it depends. Yeah. It depends on the one that you use. Now at our school, I'll show you. I have an example here. This is an N95 mask. Mm-hmm. I call them like they fit your mouth kind of like a dope bill. Yeah. So I wear it all day long, and it's easier for me to talk in that mask than it is the surgical mask for me.
Oh, it stands off your lips, right?
Yes, it does.
Oh, that's good.
So you have more room. Yes. So you may be talking about the surgical mask, but the N95 is more, it's more open so that you're able to talk a little better with the mask on, itself on. Let me see. I have one here that I can show you how it fits on. Like this. And it doesn't hinder your speech at all. Okay. Your lips are moving. You can hear me clearly, right?
Well, I hear you less clearly, but I can't hear you.
Okay. Yes, you can talk. You can talk easily with this. That's good to know. Mask on.
Yeah, the one that I have was closer to the lips. Yeah, but that's a different design. Good. Now, there's some. Go ahead.
You have an N95 mask that's closer to the lips, you're saying?
Yes, that's the one I have. Yeah, I do have that one. Also, I've heard this term, COVID fatigue, right? Folks are just tired of all this. Now, we're all tired, but why is it important for us, even when we're a little tired of all this, not to let our guard down? Why is that important?
If you care
it's obvious about question, you know what I'm saying? It's obvious, but yeah.
Yes, I would say if you care about people, if you care about yourself, number one, then you're going to care about other people. And if you care about people, you're going to do what it takes to continue to be safe. I mean, we can't go to a point where we get tired and stop and stop and let our guard down, because that means that the virus will stay around longer. That means that the vaccine and the boosters that we have are going to help in protecting us, but it's not going to completely keep you from contracting the disease if we let our guards down, if we don't utilize the tools that we have.
It's so unfortunate that we should be farther along than we are now, obviously, and we know that the main reason is we don't have enough people vaccinated to get to that herd immunity, right? So we're having to, it's just so unfortunate. And we have to guard our hearts, not to be bitter at people, but I'm disappointed at people, I'll say, who just don't seem to believe that either it's helpful or that the vaccines are safe and effective, which they've been proven to be over and over again. You know, people have these stories. They want to tell you that somebody got the vaccine and they heard somebody and died. Thing is, though, they don't personally know anybody. They heard a story. Everybody you know who got vaccine and boosters is doing well, but it's these stories floating around. And we can't, so we're going to, you know, conspiracies are so many. We can spend the next hour, you know, in the conspiracy, but let's focus this on what helps. All right. You got a presentation we want to share with our audience.
Yes.
And you have,
Pastor, before we get into that, I want to mention one thing that relates to what we were just talking about, how people are not vigilant. I've seen several people on the news who have gotten COVID, got sick, and almost died. And now they are promoting the vaccine.
Yeah, I've seen those.
So our hope is that you don't wait till you get to that point, until you get to that point where you have to actually physically almost die. And some people don't make it in order to tell that story. But we are happy that they are encouraging people to go ahead and get that vaccine so that they won't get vaccinated, so that they won't end up in the position that they've ended up in the hospital.
And not the least of which, putting all this pressure on the healthcare system.
Right.
You know, wearing down our healthcare workers. You know what I'm saying? And people who didn't want to get a vaccine now rushing to the hospital, demanding care for, you know, for COVID. It just doesn't make any sense. So we know that. Yeah. Okay. Well, you have a presentation as a school nurse. One of your responsibilities is to inform parents and students about COVID. Let's go back over that. There's some things we already know, but perhaps we have viewers who haven't really understood what COVID is and what we should do. So go ahead and get into your presentation now, if you could, please, Joycell.
Okay. First of all, we focus on as a school, we're going to focus on how can we get back into the classroom and do it safely. So we have some guidelines, not only from the CDC, also from the ISDH, which is the State Department of Health of Indiana. We have also the Marion County Health Department. We have several branches of the state departments that help us to fine-tune those guidelines that help us stay safe as we bring the kids back into school. And I'm going to read a little bit from the first 4 slides, especially so that we review some information that we might already know, but it doesn't hurt to go over it and remind ourselves of some things related to COVID-19. So the Indiana State Department of Health supports schools or students returning to school for their education and for their mental ability or their mental condition and social well-being. So those are the reasons why the State Department supports it, and the CDC, and also the Marion County Health Department and other IDOE, other departments, state departments. The question is, how do we return to school and stay safe? That's the question on everybody's mind before or beginning of this school year 21-22 in the fall. So there are new vaccines that help us to prevent or lessen the effect of COVID-19. A virus or germ that is spread can make people sick. We're learning about new and different strategies to help prevent and decrease the spread of the virus. And the one thing is to wear your gear, wear your mask, use sanitizer, and do the things that we've learned to do as we've been in this pandemic now for 2 years. So we want to avoid going, we want to get rid of this as soon as possible, or at least calm it down to where it's not affecting our daily lives. What is this? COVID-19, what is it? The coronavirus, COVID-19, is a respiratory illness that can make people sick and spread from person to person. Next to the virus name above, you will see a picture, and that is a picture of the COVID-19 virus as it looks under the microscope. And most recently, scientists have discovered variants of the same COVID-19 virus. The first they discovered was Delta, and now we have spreading at what looks like light speed is the Omicron variant. It appears to be a lot easier to contract than the other two versions of COVID-19. No one had ever gotten sick with COVID-19 before this pandemic, and that is because it is brand new, and people are not immune to a virus that's brand new. The virus has started to spread mainly between people who are in close contact with one another, and that is within 3 to 6 feet apart. When an infected person talks, coughs, or sneezes, respiratory droplets are released into the air and may land on people close by. And it may also be possible to get the disease by touching a surface or object that has the virus droplets on it. So it's very, very important to sanitize, use Lysol spray or other disinfectants to clean your surfaces well and to keep your air volume low with the viral spread. So COVID-19 is called a pandemic. It's a pandemic flu. And it occurs when a new strand of flu, we get the flu vaccine every year, but this is a new strand. And this strand, when a new strand emerge, it is different from the seasonal flu and will spread quickly from person to person. This virus infects people worldwide because it's new. Most people will not have immunity, the ability to fight off the disease because it's new. Treatment of the virus is mainly by vaccine that is available to adults and children. Other medications are available, but the vaccines have proven to be a good means of avoiding getting the disease and also spreading it. Okay, so we want to make sure in making plans to return to our schools and be safe, our administration workers, our principals, and our superintendents, they work hard to keep our children safe. So school and health officials recognize this is not a one-size-fits-all situations. Even in our own district, every school will have a little variation in what we use to keep our families, our kids, and our communities safe, okay? So schools are working with the Indiana Department of Education, the IDOE, to obtain the best practice or guideline for reopening schools safely. Now I'm gonna talk about my responsibility as a school nurse. The school nurse is responsible for patient care, education, communicating, and reporting important information between the school and our local officials. On a daily basis, the school nurse, I have to report to the Marion County Health Department all of the students who test positive, and also have to report the number of students who are quarantined. That report has to go to my administration so that they can keep track of how this disease is spreading. And there is a chart in the ISDH, Indiana State Department of Health website. Is on their website showing when students and staff members can return to school safely after a COVID-19 illness. The CDC guidelines and the ISDH chart gives more specific details about when to return to school or work. The CDC has recommended that you may return to school after you have been fever-free from flu and cold symptoms for 24 hours without the use of fever-reducing medication. Okay, so now when we send students home, the change is, or the update is, that students are required to stay home 5 days and return on the 6th day if they have been exposed or if they are infected with the COVID-19 virus. The role of the school nurse during this pandemic is to educate faculty and staff about COVID-19 guidelines and recommendations. Your school nurse will be first in the line in screening students and staff who may exhibit symptoms. I am responsible for checking their temperature, just assessing their condition in order to keep the other kids safe. I do that and determine whether they go home or not, okay? So with that, let me move on to some strategies to help prevent the spread of COVID-19. We want to be vigilant in wearing a face mask. A surgical mask can be used, but the professionals, the CDC and other organizations are suggesting that we now move to the N95 mask. Over your, you want to place your mask, wear it properly over your nose and mouth, especially if you have any kind of symptoms going on. You want to continually wash your hands with soap and water. You can't wash your hands enough. Use hand sanitizer if hand washing is not available to stop the germs from being passed from on surfaces, on your hands. As you eat, you want to be careful to wash your hands before you eat so that you don't infect yourself with germs that you picked up from surfaces. You want to practice social distancing. Stay at least 3 to 6 feet apart from the person next to you in order to lessen your chance of getting infected. So some more strategies that we use and that are suggested by CDC and our other health organizations is to stay home when you are sick. Screen for symptoms and get tested. Now, as far as screening, we ask our parents, and we have, and I'll just hold it up right here for a moment so you can see it. We have actually a screening example of what you need to screen for that parents can take home and look at that. So parents, on a daily basis, you need to screen for, check their temperatures. and make sure that it's not close to 100.4 or even 100. If it is, keep the child home. Sore throat, check for sore throat. Ask your kid how they're doing before they leave the house to go to school. If they're coughing or have a short breath, if they get tired quickly, you want to check and see if they're okay. If they have diarrhea, vomiting, or abdominal pain, keep them home. These seem like simple things that parents should know to check for, but sometimes you're in a rush, you're busy, you're getting those kids together so they can get to the bus, and you may not think to check their symptoms. But I want to re-emphasize over and over again that you want to check for these symptoms every day before your child leaves to go to school. Again, now we move on. You want to drink lots of fluids, water, stay hydrated. These are simple things that we can do to help ourselves during this pandemic. If you don't take vitamins or supplements, I would encourage you to talk to your doctor or talk to your nurse about what type of vitamins will help your immune system, help boost your immune system during this pandemic to keep you from getting ill. On a personal note, vitamin C, vitamin or zinc, and other vitamins can help boost your immune system so that you're not as susceptible to getting infected as others. Also, vitamin B. Those that I named are very important in helping your immune system be strong and not fall to this virus.
Let me ask you, so we're clear with the audience, we're not saying vitamins will prevent COVID.
No.
Right.
No, but it'll boost your immune system so you are less likely to get infected. Or even if you get infected, your illnesses will not be as intense.
And that's along with the vaccination and boosters, right? We're not saying
exactly.
We're not saying
yes.
do herbal, self-medicate, right?
No.
Yeah,
no.
people sometimes think that I got a secret concoction I take that keep me from getting, okay, good. It's all the above.
But a lot of those, lot of the concoction that they're talking about are vitamins and supplements,
right.
Which is why I named that. I named some of the things that doctors will tell you can take to help boost your immune system.
Very good.
Okay. So allow your body to rest. Now, I'm talking to myself, first of all. You need to get plenty of rest so your body is not tired and unable to fight off illnesses and infections. Contact your doctor if symptoms do not improve within 2 to 3 days. Okay, so let's go over some of the common symptoms that are related to COVID-19. You want to check for a fever, and it's your temperature or fevers are running around 100.4 degrees or more with COVID-19. If you're feeling feverish, and that means that you're warm with a cold chill, you're hot and cold, cough, sore throat, runny or stuffy nose, muscles or body aches, headaches, fatigue, that is tiredness, shortness of breath. Some people may have nausea, vomiting, and diarrhea. Though this is more common in children than adults, some people may also experience loss of taste and smell. With these symptoms, it's really a unique situation where some people experience some of these, but not others. So it just depends on your body and how the virus attacks in your body, which symptoms you will be you will fall privy to, but these are the common ones that come forth with COVID-19. Flu symptoms can be mild or severe and may include other symptoms too. It is important to note that everyone with flu symptoms may not have a fever. So there are some people who test positive for COVID-19, but they don't have a lot of the symptoms that were named on there, and they don't have a fever, okay? So most people with the flu have mild symptoms and may not need professional or medical care during the illness. But we found with COVID-19, a lot of people who have underlying conditions will need to have professional or medical care. And a lot of them will even be admitted into the hospital. So if you're sick with flu-like symptoms, in most cases, you definitely want to stay home. Avoid contact with other people except in the event that you need professional or medical care. However, if you are in a high-risk group, elderly, as again I said, with underlying condition, it may be best to call your doctor for a virtual visit or a in-person visit to discuss some of the symptoms or risks that you might have. So you want to follow the CDC guidelines and recommendations to avoid as much exposure to this virus as possible.
Now, just so I'm also want to ask this question. So we have coronavirus. There is also the regular flu too, right? Still,
exactly.
We still have to combat that too, correct?
Exactly. Mm-hmm. Yes. And a lot of people have gotten the flu vaccine, which will help combat the other symptoms, as well as your new vaccines for the COVID-19 that helps to combat those symptoms. Good. So it's real important to stay up on your vaccines. Just as we have to be vaccinated to go into the schools, we must be vaccinated to keep this pandemic from going on longer than it should. Okay. So moving along, let's encourage testing as much as possible. So if you suspect that someone has COVID-19 or are dealing with the symptoms, you might want to encourage them to go ahead and get the vaccine if they don't have it, and also get tested. One thing with your testing, you can test at home, but we're finding that the home testing may not be as reliable as
I wanted to ask you that question next. Yeah, I'm glad you addressed that. I was going to ask you about home testing kits, but you're saying that not as reliable. Yeah. Mm-hmm.
Now, what studies have found that the home testing kit may be more reliable when you get a positive result than when you get a negative result. So to avoid the possibility of getting a wrong result, we encourage our parents to go to a clinic, a hospital, or see your doctor or a professional to get the COVID test rather than using the
false negative. That's a big problem, right? A false negative is a problem.
It is.
Yeah, okay.
Definitely, it is. Mm-hmm. Yes. Yeah. False positive is not quite as dangerous as a false negative, but they are both can help us as far as diagnosis and all of that, and keeping everyone safe. Okay, if a student or staff member is suspected of COVID-19 symptoms, they will be sent home and encouraged to contact their health care professional to get tested. If they test positive for the virus, they will be asked to quarantine at home for 5 days. That's a big change. It was 10 days. Now the requirement is 5 days. They return to school on the 6th day. If they have been fever-free for 24 hours without medication and other symptoms are improving. They are asked to continue wearing a mask in school and in public until the full 10 days are up, and they are no longer showing symptoms. So we're doing everything we can in the school system and teaching our parents and the community about doing everything we can to protect ourselves and others. They must be isolated, and if test results are positive, contact tracing must be done. In other words, we're going to test and isolate people, but if you contract COVID, then contact tracing is very important. That means that you check to see who was around that person who had contracted COVID or in close contact. And if you find out who has been in close contact with someone who has it, then you want to limit the spread by sending that person home, okay? So that they are not spreading it and not knowing whether they are positive or not. So we send those people home and ask them to get tested. So you want to keep in mind in your school settings that you should make plans to provide a clean and safe, healthy environment for your students, a safe building environment. That means your ventilation is good. That is a maintenance job. But to keep everyone safe, you want to make sure that your ventilation system is good. Safe, healthy activities are good to carry out for the students to keep them uplifted and healthy. Safe, healthy schedule for the kids. So in our school, we make sure that we keep kids, even in the classroom, they are in pods. What that means is we may have 3 to 5 kids sectioned off, and they can only work in that group in their classroom when they go to lunch and other activities. So it'll be up to your school district or your particular school what safety measures you want to do to protect your students. In order to
also
promote
add something, Joycell, if I may.
Okay.
What you said there about schools is also applicable to businesses, churches, where people gather, right?
Yes,
Mm-hmm.
of course. Any public area, community setting, you want to utilize all of these guidelines that are shared by the CDC, and the state departments of health. So in order to promote a healthy environment for the school, we all have an important role to play as we return to school. We should all follow the guidelines that are put forth. Plan to communicate with your school administrators and teachers to stay current, as well as all learn about implementing new policies. Now, to get all of this information, we're sharing it pretty fast during this presentation, but if you will go to the websites that are referenced in this presentation, and also if you use your computer and go to the CDC website or the Indiana Department of Public Health, all of those different websites will have updated information about the COVID-19 virus and resources that you can tap into, the number that you can dial to get information if you don't have access to the websites and different websites. You can also dial 211. There's someone at that number all the time who can answer 24 hours a day, who can answer your questions.
Not
211.
911, but 211, right? Not 911.
211.
Yeah, 211.
Exactly, not 911.
Yes. Wow.
You can get help with 911, but not with the information about COVID.
Yes.
Okay.
That's
So
right. It's emergency help. Yes.
Yes.
Well, Nurse Ingram, this has been very informative. And, you know, those of us who are watching and listening, we learned a couple of things, right? We knew a lot of this. That's why we have updates, right? There are other things to know. So I appreciate your insight. And most of all, just thank you for your service to our community and to your school, to our church. We appreciate that God has kept you. You know, you've kept because you want to be kept. The old saying is,
yes, I do.
God to keep you if you want to be kept.
Yes.
So it's obvious you want to be kept, and He's kept you safe as you have navigated and served the children and the parents and everybody else. I know that we talked earlier about that sometimes parents are not cooperative, and we're having this problem in the community at large of people not cooperating. And so hence this pandemic continued, and the variants develop out of people, you know, who are getting together.
Not being vaccinated, exactly.
They're creating these variants.
Yes.
So, but we remain hopeful, prayerful. So you want to share anything else before we prepare to wrap up? Anything you want to share with our audience before we conclude?
Yes, I just want to encourage our parents. We know that you, as well as everyone else, we're under a lot of pressure to stay safe during this time. And so if you will just be patient, as I'm encouraging all of us to be patient and work with one another, work together to solve or have a solution to this pandemic that works for everyone, you know, so we can all be safe and live until it's time for us to go and not leave before our time. Right.
Well, thank you so much, Nurse Ingram. We appreciate this time, and thank you for, again, just serving and making a difference with those with whom you serve. So again, thank you so much, and I trust you enjoyed the discussion. If you want more information, I put the slide up at the end of the presentation. If you're watching on Facebook, you can go ahead and leave a comment, or on YouTube, leave us some comments. We'll monitor those comments and respond as we're able to. All right, so God bless everybody, and be safe, stay connected, get vaccinated.
And get vaccinated. That's what I wanted to say.
Get your rest,
please,
get your vitamins, water, all the above, right?
Yes.
Yeah, okay.
Yes.
We got the message, Nurse. Thank you so much.